Hi, today I'm here with Dr. Simon Nusinovici. I'm Dr. Low here from Eye Center, and Dr. Simon is from Ocular Epidemiology Group and assistant professor in SERI. Today we're talking about your paper in high-density lipoprotein 3 cholesterol and its association with primary open-angle glaucoma. Nice to meet you, Simon.
Nice to meet you too.
So I wanted to ask you first, what is your usual scope of your research interests and why did you look at this topic?
First, thank you for having me today. I'm an epidemiologist and I'm working mainly in the field of precision public health. So I'm looking at some identification of new biomarker for eye diseases, but also for metabolic diseases. And this is a very exciting field of research because at the same time that can help unravel disease mechanism, and you can help enhance disease prediction and also identify new drug target. So this is a very exciting field, from more fundamental unraveling disease mechanism to more applied research, enhanced disease prediction.
What prompted your team to look specifically into the link between serum lipid levels and glaucoma, and why POAG specifically as well?
Yeah, this is an important question because lipids are to some extent modifiable. So it is important to know whether there is an association with lipids, between POAG and lipids. We look at this question in the literature and it was really not clear. The results were very conflicting. Some teams find a positive association between hyperlipidemia and POAG, and some other decreased risk associated with hyperlipidemia. So it was very discrepant, and what we thought is that hyperlipidemia as a whole might not be the relevant way to look at it, but maybe to look at it more specifically with more lipids into the details. And because we had very detailed metabolomic data in our seed cohort, we looked at it. We looked at the association between all the lipids and POAG.
Yeah, and with regards to the research findings, how do you explain your finding that HDL3 was found to be causally related with POAG?
We first look at the statistical association. That's the way to proceed. You use some kind of model. And so we found an association between this particular type of lipid, the cholesterol subtraction in HDL3, that was associated with PAG, and meaning that in patients with POAG, they had decreased a lower level of HDL3 cholesterol. So, as you know, a statistical association doesn't mean that there is a causal effect. So, we did a Mendelian randomization analysis that allowed to assess the causality, and we did find a causal effect. So there's really a causal relationship between this type of cholesterol in HDL3 and the risk of POAG.
That's very interesting, actually. It really is. And you did mention that the other lipids, you did include quite a lot of lipids in this study, and they were all included in your analysis. And so were the findings that HDL3 was specifically related compared to the other lipids? Was it surprising to the team? Was it?
Yes, exactly. You're right. We looked at, we have like 130 different kind of lipids in our data available. So all the lipoproteins particles, subclasses, and within each subclasses, the corresponding subfraction, cholesterol, phospholipids. So when 130 of them, we looked at all the possible association, and specifically as we found this HDL3 cholesterol. We also tested the routine lipids, and interestingly, none was significant. So it's really really indicate the specificity of this type of lipoprotein. So, and it is very interesting because HDL3 particles, they are involved in the cholesterol transport through the reverse cholesterol transport. And they are very efficient in transporting the cholesterol. And because of that, they have anti-inflammatory, anti-atherogenic properties. So if there is less cholesterol in HDL3, there might be a deficient in the transport, meaning that in some peripheral tissues, there might be an accumulation of cholesterol that can be toxic, that can lead to an increased risk of atherosclerosis, that can lead to a decreased blood supply and damage in the retinal fibers and the RGC loss eventually. So that's how we interpret the results.
Yeah, that's really interesting because it really gives us kind of like a different perspective on pathogenesis and all the mechanisms.
Yeah, correct.
And for this project, how did the team work together? Like how did you guys conceptualize and manage the whole project?
Yeah, this is a good question. This is definitely teamwork. So we first looked at the literature. We saw that possibly we could answer to that question. So we reviewed the literature. I run like most of the analysis, the statistical analysis. We have like one colleague specialized in genetic data that run the Mendelian randomization analysis, Han Tong Lee, that did a great job at it. Ocular epidemiology team led by Prof. Cheng. We discussed many times the results to refine the analysis. And we also discussed with the clinicians on the interpretation of the results. And so that's definitely a teamwork. Yeah.
Yeah. Even with such good teamwork, did you maybe encounter some difficulties when you were carrying out this project?
Yeah, sure. We had some difficulties. First, maybe I would say that it was the POAG. You know that the prevalence is very low, so it's difficult to get like high numbers of patients. And as I mentioned, like 130 different lipids. So it's like in terms of statistics, challenging to use the correct model to test the association with like low numbers of patients and a very high number of possible factors to look at the association. So we had to use some more advanced statistical techniques. And then the second difficulty was the Mendelian randomization analysis that allows us to assess the causality, which you need for that to collect relevant genetic data. There's a lot of different analyses with different assumptions, so it's not a straightforward analysis, so we had to look at it like into the details. So yeah, that was the two main difficulties we had to handle.
But I think going forward, what do you think you'd like to see with regards to future research in view of what you've maybe found in this paper?
Yes, I think the first thing is that we need to replicate in a different population these results. Second, what I would be very interested in is to look whether there is a dose-response relationship, whether with patients with more severe POAG, whether there is even more higher decrease of this type of cholesterol. That would be very interesting. And also we need now to look at the association longitudinally to see whether at baseline, for example, this type of cholesterol would be associated with maybe the incidence or the progression,
Yes.
So we don't know that. And but we are still far from any kind of clinical translation. That's some kind of preliminary results. And we also need like to do proper biological analysis to look at the detailed mechanism that could explain this association, maybe involving the ABCA1 protein that are responsible of the transport of the cholesterol inside the HDL3. That could be some possible mechanism, but some proper biological studies are needed to really answer this kind of question.
So it sounds like you have a lot of work to do.
There is also indeed like a lot of work,
Which is a good thing. So I think we'll be looking forward to hearing more from you in the future when you look into all these things. But I'd like to thank you for the interview today. It was a pleasure to have you to discuss your paper.
Thank you very much. Thanks for having me today.